Let's talk about promoting healthful living in the primary care setting, Chapter 17. We have a theoretical framework. Primary health care promotes prevention, care, and independence of healthcare services. This is a health-illness continuum, moving between states of illness and wellness throughout life. It can also include dependence and independence. Primary health care. That's maintaining independent, healthy individuals in a community. Here's another example of the theoretical framework health-illness continuum. Let's look at self-care. Self-care is the ability that can be affected by many things, and nursing care is sought when a self-care deficit cannot be resolved without specific medical and nursing knowledge. Orem in 2001 believes that every individual has some self-care ability, day-to-day personal care needed to function and develop. The ability is affected by several things, including but not limited to the individual's age, developmental stage, health, and environmental factors. Adults seek assistance when they have self-care deficits. Nurses involved in health promotion include for people that are under the direct care of a nurse, the nurses engaging in practice that prevent or interrupt the disease process in the environment of the patient. The nurse guides people towards health prevention methods. The nurse is incorporating factual information about the patient into the plan of care, and the nurse is aware that the adult or responsible adult will be the primary person to carry out the plan of care. Let's talk about the health promotion model. RN should model and encourage health protective behaviors. Many factors can influence health promotion, including individual perceptions and experiences, and interpersonal and situational influences. Key to the model are characteristics and experiences influenced by individuals' perceptions and interpersonal and situational influences on health. Every factor has some degree of influence on healthy behaviors, and the nurse should consider these to know how to assist the patient. Health protective behaviors take a person away from a dangerous situation or habit. Health promotion behaviors are more an individual to a higher level of health is greater vigor and energy. Health promotion includes health education, health screening, and disease prevention. Health promotion principles. Influences on the patient's health promotion, such as external support, must be considered while constructing the health promotion matrix, which helps the nurse to understand the patient's self-care capabilities more clearly. The health promotion matrix is the individual is surrounded by and influenced by systems of family, group, and community. Systems can have a positive, supportive influence or a negative influence on the patient's health promotion. Orem in 2001 considers self-care as meeting one's own basic needs. Universally, it's essential requirements for everyone. Developmentally, it's needs for each life cycle period. The health deviation needs the individual's genetic or constitutional deviations from normal. It's basically internal versus external orientation. Health promotion plan of care. The health promotion plan of care is holistic, comprehensive, and encourages the patient to regain control of his or her health through education and self-understanding. It includes education and self-actualization exercises to help the individual seek a higher level of health. It's a priority for health promotion. It helps the patient regain control over their health. The priority nursing diagnoses are health-seeking behaviors and knowledge deficit. The outcome criteria is progress towards higher level of health. You want to include the patient as a means to empowerment and compliance. The RN's role in health promotion is basically that the RN can participate on the local level by visiting community organizations with the health promotion presentation, and on the regional level by advocating change in legislation to improve the health environment. Besides designing individual plans of care, the RN can also be proactive in health promotion on a local or a regional political level. Okay, so let's look at health promotion principles, practice question number 1. A nurse is providing health promotion to a patient with developmental needs. Which needs are the nurse trying to meet? Is it food and water, genetic and normal, education and self-actualization, or trust and belonging? Have you decided on an answer yet? It is number 4, trust and belonging. Developmental needs such as trust, love, and belonging change as a person moves through each life cycle period. Let's look at the environmental influences on health promotion. The influence of a patient's environment must be considered when assessing the healthcare abilities. Everyone exists in an environment. It could be either supportive or stressful. So let's review some of the components. We have the physical component. The physical factors are concrete and can be measured. When it is not possible to remove or eliminate the physical factors that affect a patient's health, creative solutions must be sought to minimize the influence and satisfy the patient. Tangible factors where the individual lives. It begins with the assessment of the environment that have been implicated as causing health variations for the individual or the community. The plan of the care is developed to minimize the negative influence of the physical environment. Interventions focus on either avoidance of the environmental factors or modifying lifestyles to minimize their effects. Then we have the cultural, spiritual, and social components. The main cultural influence on healthcare dietary habits is one, and then spiritual supports are chosen by the patient, may be different from those of the nurse, but should be encouraged if they promote the patient's health. Social supports can be in the form of either open or closed systems, accepting external, community support, or preferring only familial support, respectively. It plays a major role in how an individual views health and illness. Looking at cultural, a lot of times there's a difference in dietary habits. Spiritually, they have help from a higher power in their thought process. Socially, they may have support from people. We have to look at open versus closed systems. Then we have the economic component. The RN should help low-income families access low-cost or free services through nonprofit or religious organizations. High costs influence health-seeking behavior and force some patients to seek only illness care and not wellness care. Some of the economic factors can affect health promotion behaviors. Low-income groups usually do not seek preventative care. Then we have the developmental component. Because developmental factors affect health-seeking behaviors, the RN must understand the role these factors play in the patient's health in order to initiate a plan of care in collaboration with the patient. Patients cope with stress in different ways. Unhealthy stress behaviors should be addressed and the patient presented with alternative strategies to maintain an optimal health environment. We have adaptive potential and self-actualization. What comes to mind when you say primary healthcare systems? Primary healthcare systems include the primary care physician and the state and local health departments. Health departments follow strict regulations, and funding is often linked to outcome measurement. Health promotion is part of the nurse's role. Many other organizations and individuals provide primary health care, such as the family nurse practitioner and the family practice physician. They are primary health care providers. The patient will seek them out and trust their counsel with help to keep them well. Primary services, physicals, immunizations, and screenings for potential health problems, and then monitoring for health and well-being. The RN can refer to the family practice physician or the nurse practitioner as part of the health promotion plan of care. Then we have public health. They set standards for health. They implement interventions to meet the standards. They monitor the outcomes in an effort to improve the general health of the community, and they focus on actions that minimize potentially widespread health problems. Do you think about health promotion around the world? Health promotion is a global concern inviting input from organizations such as the World Health Organization and the U.S. government. Supported by the U.S. Department of Health and Human Services, Healthy People 2020 lists objectives for more than 40 topics that are national health concerns. Some of these topics include for national effort to improve the lives and health of all Americans. They address many health issues, and they have responsibility to promote these healthy objectives for both you and your patients. Then we need to discuss self-health promotion. You need to have a healthy lifestyle. It bolsters self-confidence. It can model lifestyle for others, especially the patients. So basically, you need to practice what you preach, and it lends credibility to your role as a patient advocate. So to recap, maintaining and modeling a healthy lifestyle will bolster self-confidence and minimize the stresses of balancing family, education, and career. This concludes this lesson.